Today's topic is what is a cesarean section? Cesarean delivery, also known as C-section, is a surgical procedure used to deliver a baby through incisions in the abdomen and uterus. A C-section might be planned ahead of time if there are any pregnancy complications, or had a previous C-section and aren't considering vaginal birth after a cesarean. Often, the need for a first-time C-section doesn't become obvious until labor is underway. Reasons for a C-section. Sometimes a C-section is safer for you or your baby than a vaginal delivery. A C-section can be recommended if your labor isn't progressing. Stalled labor is one of the most common reasons for a C-section. Stalled labor might occur if your cervix is not opening enough, despite strong contractions over several hours. Your baby is in distress. If your healthcare provider is concerned about changes in your baby's heartbeat, a C-section might be the best option. Your baby or babies are in an abnormal position. A C-section might be the safest way to deliver the baby if his or her feet or buttocks enter the birth canal first, or the baby is positioned side or shoulder first. You are carrying multiples. A C-section might be needed if you are carrying twins and the leading baby is in an abnormal position, or if you have triplets or more babies. There is a problem with your placenta. If the placenta covers the opening of your cervix, as in placenta previa, a C-section is recommended for delivery. Prolapsed umbilical cord. A C-section might be recommended if a loop of umbilical cord slips through your cervix ahead of your baby. You have a health concern. A C-section might be recommended if you have a severe health problem, such as a heart or brain condition. A C-section is also recommended if you have an active genital herpes infection at the time of labor. Mechanical obstruction. You might need a C-section if you have a large fibroid obstructing the birth canal, a severely displaced pelvic fracture, or your baby has a condition that can cause the head to be unusually large, like severe hydrocephalus. You have had a previous C-section. Depending on the type of uterine incision and other factors, it is often possible to attempt a VBAC, or vaginal birth, after cesarean. In some cases, however, your healthcare provider might recommend a repeat C-section. Some women request C-sections with their first babies to avoid labor or the possible complications of vaginal birth, or to take advantage of the convenience of a planned delivery. However, this is discouraged if you plan on having several children. Women who have multiple C-sections are at increased risk of placental problems, as well as heavy bleeding, which might require surgical removal of the uterus or hysterectomy. If you are considering a planned C-section for your first delivery, work with your healthcare provider to make the best decision for you and your baby. Risks with a C-section. It can cause breathing problems for babies. Babies born by scheduled C-section are more likely to develop transient tachypnea, a breathing problem marked by abnormally fast breathing during the first few days after birth. Although rare, accidental nicks to the baby's skin can occur during surgery. After a C-section, you might be at risk of developing an infection of the lining of the uterus, or endometritis. A C-section might cause heavy bleeding during and after delivery. Adverse reactions to any type of anesthesia are possible. A C-section might increase your risk of developing a blood clot inside a deep vein, especially in the legs or pelvic organs, like a deep vein thrombosis. If a blood clot travels to your lungs and blocks blood flow, like a pulmonary embolism, the damage can be life-threatening. Depending on your risk factors and whether you need an emergency C-section, you might be at increased risk of an incision infection. Although rare, surgical injuries to the bladder or bowel can occur during a C-section. If there is a surgical injury during your C-section, additional surgery might be needed. Increased risks during future pregnancies. The more C-sections you have, the higher your risks of placenta previa and a condition in which the placenta becomes abnormally attached to the wall of the uterus, or placenta accreta. The risk of your uterus tearing open along the scar line from a prior C-section or uterine rupture is also higher if you attempt a VBAC. Preparation for C-section. If your C-section is scheduled in advance, your healthcare provider might suggest talking with an anesthesiologist about any possible medical conditions that would increase your risk of anesthesia complications. Your healthcare provider might also recommend certain blood tests before your C-section. After a C-section, you will need time to rest and recover. Consider recruiting help ahead of time for the weeks after the birth of your baby. If you do not plan to deliver any more children, you might talk to your healthcare provider about long-lasting reversible birth control or permanent birth control. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.